Hello, my name is Maria Mackenzie and I am from a blog called No Spring Chicken. I am here today to get the treatment Ultherapy. I have done an awful lot of research into various kinds of treatments within salons, and Ultherapy was the one that stood out to me. One of the reasons being it's FDA approved, which is really, really important. I think when it comes to your face, you obviously need to really trust who you're going into. That was the number one for me. I am a 42-year-old mum, I'm busy, I've got a job, I've got the blog, and I wanted to do something that was a little bit more than getting a facial or getting a peel. I wanted something that would get down really deep down into the layers and kind of give me a real rejuvenated look, and that's what I'm hoping I will get from Ultherapy. But when it comes to getting something that is really effective and long lasting, I think you need to go to the professionals, and hence the reason why I'm here at the Laser and Skin Clinic with Anna. So I am very excited. I am hoping for wonderful results. I know it can take at least 3 to 6 months to see anything, but I think when it's your face and it's an investment in you, I think it's really important to be a little bit patient with these things. So I'm very excited, as I said, to get it done today, and yeah.
Hi Maria.
Hello Anna, I'm fine, and how are you?
Welcome to the Laser and Skin Clinic.
Thank you very much, I'm very excited.
So what we're going to do today is we're just going to have a chat about your treatment before you have your treatment. We've had a consultation a few weeks ago, so now you've decided to go ahead with your Ultherapy treatment.
I have indeed.
So what we're going to do is we're going to do full face and we're going to do upper neck, and that's your main areas of concern.
Yes.
So basically you're feeling that underneath here, you're finding that the skin is getting a little bit lax.
Yes.
And the muscle is getting a little bit loose.
Yes.
So just underneath this area here.
And underneath here, exactly. I suppose as I have aged, I have found that this part has kind of has lost its elasticity, and it's kind of started to droop, and the definition there in my jaw is gone.
Well, Ultherapy is an amazing treatment because it's a non-invasive treatment that will work on the deeper layers of your skin, so especially on the muscle layer, the SMAS layer.
Yes.
And that's what holds everything together. So basically that layer gets loose as you age, and then the fat pads come with it, so that creates then the jowling area around here. So what we're going to do is we tighten up the SMAS layer.
Great.
And that then will lift everything, all of the rest of the anatomy with it.
Yes.
And then we'll also stimulate the middle layer of your skin, the dermal layer, to increase the collagen and elastin in the skin, which is also going to improve the quality and the texture of your skin.
Brilliant.
Okay.
Yeah.
You stop making collagen from the age of around 27.
Right.
So basically then the skin creases easier over time.
Right.
So, but we're going to treat all the different layers of your skin. So we're going to treat the muscle layer, and we're also going to treat the dermal layer and the upper layers of your skin.
Brilliant.
To treat it as a overall rejuvenation treatment. We're going to mark out your areas, and then we will start the treatment. The treatment is very comfortable, and we will customise this treatment to your anatomy, so we can visualise your anatomy on the screen. This is the only system in the world that we can actually see inside your skin while we're treating.
Great.
So we will customise the depths when we are on your SMAS layer, which is very important.
Yeah.
We will then fire the energy, and that energy then will, over the next 3 to 6 months, will cause the retraction of that muscle.
Brilliant.
And the tightening effect that you want.
It's something that it doesn't hugely bother me, but it's one of those things that I want to do something about now before it gets to the stage where I'm actually going, now I need to go for the scalpel, and that was something I wasn't interested in.
Most people are not symmetrical, so one side of their face might drop, and they notice it more as they age. So that's where Ultherapy can come in, where you can customise more energy on one side to correct.
Brilliant.
So you can correct maybe a drooped brow, or you can correct one side of the face may have a little bit more laxity than the other.
Yes.
So you can actually customise the energy to that person, which is amazing with a treatment. So this is the only FDA approved treatment in the world that you can visualise your anatomy while we're treating. So that's why it's very important that there's lots of other technologies out there, lots of other ultrasound technologies, but you can't actually see what you're doing when you're delivering that energy into the skin.
Yeah.
So this is very unique, this system. We've had amazing results with it.
Brilliant.
And you can use it on smaller areas, or you can use it on the full face, neck, décolleté. So it's very exciting that we have this non-invasive, non-surgical option for people, because not everybody wants to go down the route of surgery, because there obviously is a lot more risks.
Yes.
It can be combined with other treatments, which is amazing as well, but this is the only treatment that we have that we can actually reach the muscle layer of your skin.
And that really appealed to me, in fairness, when I was doing my research into it. All of those elements really appealed to me, and also the fact that there's very little downtime. You know, as a busy mum, you can't be spending weeks you know, in the Ritz having champagne served to you. That would be lovely while you recover. So it's something that I wanted to get done, and that I'm happy to be patient and wait for it. And I you know, you don't need to see instant results when you're happy to wait for something that's going to work in the long term, because I think when it comes to your face, you know, everyone is a little bit more hesitant. Like if it's coming to doing something, augmentation or whatever in the body, you can cover it up with clothes, but your face is everything. And I was really careful in choosing something like this, because I wanted to know that obviously the FDA approved thing was huge for me, all of the amazing reviews that it got, and yourself as well, and that was really important to me, that I could go to somebody that I could trust with your face, because you know, it's the thing that's out to the world, and you know, I want to age well, I want to look as good as I possibly can, and hopefully I won't need to touch a scalpel for the end of time. But
well, as you said, the no downtime, minimal recovery is very important to people. People are very busy now, they have a lot going on, so it's very important they can do a treatment and they don't have to take time off, and it's working over the months, and nobody really knows. So it's a gradual improvement that people start saying, you look really well, but they don't know what you've had. So it's not really an enhancement that's going to change you, it's only going to make you look fresher, make you look better.
Fantastic. Brilliant.
Great.
Okay, lovely.
What we're doing is we're just applying the ultrasound gel so that we can glide the transducer while we're doing the treatment. So we're going to start here on the right side, and I'm going to check now the depth of Maria's muscle. So we're going to just check on the screen. So we're going to start. So the actual energy, ultrasound energy, is delivered onto the SMAS layer, which will cause over 3 to 6 months the muscle layer to rejuvenate and tighten. There'll be no downtime with the treatment. Maybe a slight bit of swelling, a little bit of paleness to the skin for a few hours, maybe a little bit of tenderness, but apart from that there's no aftercare, and we just let the energy do the work over the 6 months. Therapy works very well for the upper face. Some people might just want to concentrate on the upper face, which is fine. So we just deliver the energy again onto the muscles so that we create that lift and tightening effect.